Hey everyone, it's Tim Baldermann and welcome to this edition of Too Honest for Social Media, where we talk about important issues at the local, county, state, and even federal level from time to time. Right now we're talking about a regional situation here with Silver Cross Hospital. I'm very fortunate to be joined by a good friend and a wonderful leader in our community, the president and CEO of Silver Cross Hospital, Michael Mutterer. Michael, thanks for joining me.
Yeah, thank you, Tim. Thanks for having me.
Absolutely. Well, as you've heard me say many, many times, many people have said, I've been the mayor since 2007. And Silver Cross came to me at that pretty early on in my time here as mayor about wanting to come to New Lenox as a replacement hospital. And it was a no-brainer for me with the great reputation they have. But it has certainly exceeded what I thought it would be. I don't know about you and what your staff, those who were there back then, what their thoughts were. But as long as I'm mayor, I can't imagine that we'd ever have a better project for our community and for the region than bringing you here. So.
Yeah, I mean, healthcare in the community is so important, and I remember driving by, back then watching the hospital being built, and understanding how important it is for the community that I live in as well. This is my 911 hospital, so I was not here at the time when the hospital got built, but very excited about it as a community member.
Absolutely. So talk a little bit about your career, how
Sure.
you got started in this field, and how you moved your way up to president and CEO.
Yeah. So I probably did not have the traditional pathway to president and CEO of a hospital. By background, I originally went to school for psychotherapy. So I have a bachelor's degree in psychology and a master's degree in clinical and counseling psychology, and am licensed and board certified as a psychotherapist. So I practiced for a number of years, but always knew there was something missing. I'm first generation to go to college, came from a small town in Wisconsin, or grew up in a small town in Wisconsin, and probably doubted myself a little bit. I probably would have went to medical school had I, could have done it all over again. But several years into practicing as a psychotherapist, I knew there was something I was missing, and it was the medical piece to really creating that whole mind, body, spirit type of treatment. So I went back to nursing school and got my nursing degree right here at Joliet Junior College, and then advanced my degree to get a BSN as well, and worked my way from the outpatient post-acute care world for a number of years. Rose up into administration very quickly in the post-acute care arena. All at the same time, I was working as a bedside nurse at a local hospital here, and just loved the environment of the hospital. And took a leadership role at another regional medical center in the area, and worked there for about a decade as the chief nursing officer, and came to Silver Cross in March of 2020.
March, yeah, great timing.
It's a great time.
Yeah, March of 2020, phenomenal. All right, well, as you know, with this program, we get right down to it. Silver Cross is definitely the jewel of beyond our community. It serves so many communities in the region with quality health care. But with any business, I don't care who you are, I don't care what you do, I don't care if you're the mayor and it's a town, I don't care if you're running a school, it doesn't matter what you're doing, there are going to be issues. One of the biggest issues over the last several years, long before you took over this role, was the emergency department, talking about wait times and that sort of thing. So talk a little bit about the history of the emergency department, kind of how that operates and what you've been doing to try and address some of those issues.
Yeah, so from the moment I stepped into this position, that has been a focus of mine. Living in the community and working in the community in which you live, you definitely get lots of feedback, as I'm sure you do. And really, I appreciate that feedback, because at the end of the day, that is how we get better. And I'm going to say 9 out of 10 concerns that I would hear from my friends, family, neighbors, community individuals was complaints about the emergency department. And over the last 18 months, and I'm going to say probably really delving into it the last 12 months to look at process improvement and workflow and, ways in which we can really look at, it's not just an emergency department problem, it truly is an entire hospital problem. So for most days out of the year, we run over 100% capacity. So that means we have more patients who are in the hospital as admitted patients than we have patient rooms for. Wow. And if you think about that, that is, trying to solve an equation to staff for more beds than you even have available, right? So today, for instance, we have 27 patients that are in overflow. So that means I have to provide care to 27 patients that I couldn't staff for because I don't even have units for them. So again, it's this equation of trying to figure out how do we really work on the whole equation versus just focusing only on the emergency department. So we put things in place like discharge by noon. It's important to think about for every minute somebody's in a bed longer than they have to be, that it's taking up that bed for the next patient that needs to come up and get into it and get out of the emergency department to open up that bed for somebody who's waiting in the waiting room to get to that bed. So really looking at this as a complex issue versus just focusing on how do we fix the emergency department.
Right. And you and I have had this conversation. You've been good enough to come to the board meeting and talk about it. So you have how many bays in the emergency department?
So we have 30 bays in the emergency department.
Right.
And that at any given time could be taken up by, this morning we had 17 of those beds taken up by patients, of which 6 happen to be behavioral health patients who have been with us for several days.
Okay.
So if you think about that, that really renders our emergency department to almost half its size.
That's unbelievable. So what you were saying was you have how many beds in the hospital, not the emergency, but how many rooms have you got in the hospital?
So 348 total licensed beds.
So you've got 348 beds. If they're all full, and the emergency room is for the emergency department's full, then you have people literally in hallways or in the waiting room. Now, those behavioral patients that you talk about that are taking up bays, once they come there, and this is what I know people don't understand, they would say, well, you've got Silver Oaks, or why don't they go somewhere else if it's not it's a behavioral issue, it's not a medical health issue, a physical health issue, it's a behavioral issue. But you're kind of bound to keep them there, right? How does that work?
Yeah, so when a behavioral health patient has a need to be hospitalized, typically people bring them to an emergency room, so like Silver Cross, right?
Sure.
And so we medically clear them to make sure that they're medically stable to go to a psychiatric hospital for which really isn't equipped to take care of complex medical issues.
Sure.
So when we clear them and say that they're ready to be dispositioned to a behavioral health hospital, then the challenge becomes, where is there an open bed? So Silver Oaks, great partner of ours, is 112 beds, and they too run at almost always capacity. And so when that situation arises, while they partner very well with us and try to take us or our patients from our emergency department first, there are days that they just can't take admissions.
Sure.
So then we're looking at other area behavioral health hospitals to be able to transition those patients to. Then it gets into, does your insurance company allow the transfer to Silver Oaks or to, one of the other hospitals within the area? Because again, insurance dictates where patients can go. So it becomes a little bit of a chess game. And, if there are no empty beds, there's no other place for us to be able to care for those patients, but to be able to continue holding them until there is a bed available for them.
And that's by law.
And that's by law.
Yeah, you're required to do that. So you have 6 or 7 behavioral health patients that are medically cleared otherwise, but if there isn't a behavioral hospital for them to go to, you have 6 or 7 fewer emergency room bays.
Correct.
Yeah.
Correct.
And that's a lot. That happens a lot. I know quite a bit.
It does. I mean, and we've had some patients, behavioral health patients, up to 30 days. So think about that.
Yeah.
Think about being in a loud, crazy environment like an emergency department and having behavioral health issues. So we know we are not the right place for that patient to be. But if there's no beds available, that literally is. So we are doing the best we can to manage those patients, manage their behaviors, manage their medications, and provide the best level of care that we can within the context of the situation, which just in and of itself isn't the best.
So you almost become a mini behavioral emergency department there with the staffing that you have that's there for medical reasons, but now they've become behavioral doctors and nurses.
100%.
Staff. Wow. Another thing that, and of course I've known for quite some time, but I was surprised when I first heard it, is somebody comes in the room and they have into the emergency department and they have a sprain or a strain, or they hurt their leg, they hurt their arm. you cannot send them to urgent care. Is that correct?
That is correct. So once they make it within 500 yards of our emergency department doors, basically.
500 yards, it's a lot.
It's a lot, right?
It's center field at field 3 at the crossroads. Yeah,
right,
exactly.
So they make it to our parking lot, basically, and we own them, right?
Yeah.
So once a patient comes into the emergency department, there are what we call EMTALA laws, and the EMTALA laws are put in place. I mean, again, they were written in the 1980s for hospitals to not be able to cherry pick patients, basically. So if you have a patient coming in that isn't funded, or doesn't have the best insurance, back in the day, hospitals could turn away patients. So the law, I think, went into place for very good reasons, but there also wasn't alternate treatment options back in the 1980s. There really wasn't the push of urgent cares and, the availability of all the physician offices and things that we have today. So I think at some point, the federal government is going to have to catch up with the EMTALA law, and in my opinion, I think that there has to be some work to advance that. But to your point, if a patient makes it to us, they walk in, and let's say, they need stitches or they have a sprain, like you said, we know they're not going to die from that.
Sure.
Right? So how quickly do you think we're going to get them back to the back?
Right, it's going to be a long time.
It's going to be a long time.
Especially when your beds are full with behavioral health patients and critical care people.
Correct. So, I mean, somebody comes in clutching their chest and, is having a heart attack, they're definitely going to get back right away.
Sure.
Whereas somebody who needs stitches or has a strain is going to wait, and probably wait a long time.
Right.
Now, we're not even allowed to say to them, hey, we have an urgent care across the street in Pavilion D that you could go to and get your stitches done in, 30 minutes and be out the door in an hour.
Right.
We legally can't do that.
Yeah.
So it is a flaw, I would say, in the system at this point that really doesn't benefit the patient, especially. I mean, it's something that I wish could be changed.
Yeah. Now, I know you have some information that kind of talks about when you should go to the hospital and when you should go to urgent care. Are you allowed to post that at your hospital? So maybe if someone's sitting in that emergency room for 3 hours, are they able to look at that and say, oh, maybe I should go across the street to the urgent care, or are you not allowed to do that?
Well, the sad thing is, Tim, we don't want them to do that then, because we get penalized for them leaving the emergency department. So that is one of the metrics that we track.
Okay.
So we track left without being seen, and AMAs, which is against medical advice. So patients who have checked in. So once you walk into our emergency department, hit the triage desk and give us your name and date of birth and your information. If you leave before you get seen and treated, we get dinged on that. So we don't want them at that. Once they make it to us.
Yeah, then you're kind of stuck. So you almost have to have a big billboard out in front of your front doors that says, should you be here? And here's the signs that you should be here, or go across the street.
Yeah.
I mean, it's crazy that you have to do that, but the laws are kind of tying
Archaic.
your hands.
They're a little archaic. Yeah.
They are. And I think, too, I mean, let's be candid. In this area, Silver Cross has a tremendous reputation. And so people who want the best care for themselves, for their kids, they may bypass other hospitals to come to Silver Cross. I'm sure you have the demographics where everyone's coming from.
Yes.
I'm sure you get a lot of people that are probably coming from places where you're not the closest hospital.
In fact, Tim, we see that more and more. So we see patients and we hear patients whose family members are driving them to Silver Cross, because if they called an ambulance, they're going to get taken to a hospital that maybe they wouldn't want to necessarily go to, right? Which we don't recommend. Obviously, if you're having a heart attack or a stroke, don't get in the car, right? Don't get in the car and drive. But we do. We are seeing higher volumes of patients than what we had in the past. And while we're blessed and very happy that patients choose us and choose Silver Cross, I mean, I laugh, and I think we joked at the board meeting a little bit that if patients would just come 10 an hour, we'd be golden.
Be fine,
right?
Right.
We'd be fine. But there is a pattern of how patients present, right? And so you might get 5 that walk in the door at 8 a.m. and another 10 that walk in the door at 9 a.m., but then 30 people come at 10 a.m. and another 30 come at 11 a.m. I mean, we couldn't size the emergency department. We couldn't staff the emergency department. You try to pick up trends in when your peak times are and staff to that, which is what we do.
Sure.
And I think we've done a lot of work on staffing to our peak times in order to help that throughput and make sure that we can get patients, especially the patients that are triaged that we know are never never going to get admitted. Like, how do we work through them quicker and get them in and out? Maybe they see an advanced practice provider versus seeing the physician, and we're able to triage them and get them stabilized and diagnosed and out the door a little bit quicker, so that frees up the room in the emergency department waiting room, for the patients who are, they're waiting to be seen by a physician and or to get back to the back to start their treatment process.
Yeah, I mean, but obviously there's no way you can know when, there's not a peak hour for heart attacks. There's not a peak hour for car accidents. They may happen,
traumas,
but it's just not traumas. Those things are going to happen. So, so you're trying. So what are so those are some of the things. Talk just a little bit more about what you've tried to do, because as you said, you have 320 some beds, and when they're full, they're full. And when you have people who are in emergency bays that probably don't belong there, but by law you're obligated to have them there. What have you done? Have you been able to open up any additional bays? What have you been able to do to try and relieve that pressure a little bit?
Sure. So, well, in order to open up additional bays, that's a certificate of need process. So, I mean, it's not like we can just expand our emergency department on our own, but we are creative. So we open up alternate area sites within the hospital. So we have pre-post bays that normally would be designated for patients that are going to have surgeries, and we will take patients to those areas. Now, the downfall of that is there's no bathroom in the room. Right. There's no windows in the room. Right. So from a patient satisfaction perspective, people are like, well, where am I?
Right.
Why am I in a room with no windows?
I'm in a bunker somewhere.
Right. I'm in a bunker somewhere. But what I will say is, we're blessed to be able to have these alternate treatment areas because we can at least get the patients to a room and they're not sitting in a hallway. So typically, we will have, I'm going to say anywhere from 8 to 12 patients who are in those type of rooms every single day. We try to use those first before we backfill the emergency department with patients that are admitted for obvious reasons, right? Because once you start that process and you start backing up your emergency department, it again backlogs the whole process. But I'll go back to, discharge before 12. When I started here in March of 2020, we had about 3% of our patients left before noon. We currently, to date, are just under 20% of our patients leave before noon, and that's a huge difference. So if you think about it, if all of our discharges happen after noon, that means by the time our EVS staff, our housekeeping staff get into the rooms and clean it and sterilize it and get it to a place where the next patient can come in, it's a couple hours later. I mean, it's a long process. So if we can get 20% of our patients discharged before noon, that process is several hours ahead of time, which means we can pull patients from the emergency department up to the floor quicker. And that whole process just keeps going. We work very hard. I talked a little bit about our metrics in the ED, our left without being seen, and our AMA. We've worked on our triage process. If you think about Disney, they're constantly making you move, right? I mean, you're standing in a line for 3 hours waiting to get on a ride, but you're moving the whole time because they got you going around the corner and through the woods. And,
sure. Yeah.
Right?
May not be a straight line, but you're moving.
May not be a straight line, but you're moving, right? And so really trying to create a thought process like that once you hit our emergency department, you're getting triaged quickly so that we know, are you a level 1 trauma, which hopefully you're not walking in the door if you're a level 1 trauma, or if you're a level 5 and you can get some time, you're probably going to be waiting a while. But from that moment, we can start looking at how do we get your labs drawn? How do we get you back for any radiology studies that need to happen and get that whole process moving so that by the time a practitioner can see you, whether it's an APN or a board certified physician from the emergency department, they've got information to be able to start making diagnostic decisions on you, right? So that process has been very helpful for us to also get that process going and keep that flow moving. So I'm going to say our nursing leadership team at Silver Cross, Joe Pateros and Laura Maida, specifically in the emergency department, have just focused so much time, energy, and effort on looking at all of our processes in the emergency department and what can we do and streamline and really focus on to help that throughput. Then Sharon Zobel, my chief nursing officer, and my entire nursing leadership team within the tower are looking at how do we continue to improve the process in the tower to help support the emergency department, because one can't can't work without the other. And I think that's the piece that we've really figured out over the course of the last 12 to 18 months, is that it's not an emergency department issue.
Right.
It's a whole hospital issue, and we're continuing to work on improving it. And I'm going to be the first to say we still have bad days, right?
Of course.
We still have bad days when the volumes,
when 30 come and another 30 come. Yeah, I mean, it is what it is.
It is what it is. Yeah.
Well, I can tell you that maybe it was 18 months ago, whatever it was. Obviously, there were some really, really difficult times, long stretches of days where it was long wait times, 12, 14, 15 hours, 20 hours. And people were complaining about that here in the community. I contacted you, and you immediately assembled your team together. We sat and talked. I relayed back to the community, hey, the president and CEO brought his team in, and people said, what's the point? Nothing's going to happen. But in reality, things have happened, and there have been major improvements. So as the mayor, I want to say thank you for that. First of all, thank you for always being so receptive to the village and what we need and our people, you and your entire team, but certainly with your leadership. And there have been changes. So for all the cynics out there who said, oh, nothing's going to come of it, they did. You made it a priority. Your team made it a priority. You're still working on it, but we've certainly seen the improvements, so we're grateful for that.
Thank you.
And
thank you for your support. I will say, as we look at our metrics and track our metrics and just the amount of time people are waiting, either pre-treatment or total amount of time for treatment, we have seen a huge trend in the right direction.
Good.
So we've made huge strides in that, and we'll continue to work on that, because as far as I'm concerned, it's an always ongoing process improvement.
Absolutely. Well, very good. Well, I think you gave a great explanation. It still is going to be tough, and there are still going to be people who are frustrated, but they have to understand where that frustration should be directed to. Everybody's working really hard over there, and you guys are doing everything you can to make a difference, but a lot of that's out of your control. So anytime you work in the sector where you have to deal with government, you can expect your hands to be tied sometimes.
That is true.
There's no doubt about it.
We have amazing team members in the emergency department ready to take care of every single patient that comes through.
Yeah, they're not happy about the fact they can't get to you sooner, because they're on their feet nonstop, running constantly.
100%.
Yeah, you've got great staff. All right, so let's talk a little bit about the fact that Silver Cross is an independent hospital. And again, we don't expect everybody to know what that means or the value of that, but that's really important. So talk a little bit about the difference and why that's important.
Yeah, so being an independent hospital, from my perspective, is almost the most important piece of how we are able to provide community-centric care. And what I mean by that is, myself and my executive team, so the people who are making the decisions about the hospital, are local to the communities in which we serve. The board of directors for which we report to are local to the communities for which we serve. Many hospitals across the nation, and particularly in our region here, are owned by parent companies that aren't even in the state of Illinois.
Okay.
So if you're governing body is making decisions about our area hospital, but they live in California and don't really understand the dynamics of how our local communities are different, they're making decisions based on what they do in California or Nevada or wherever their other hospitals are. We make decisions based on what we know is good for the communities that we serve. And I will say, we recently updated our vision statement to include that we, as the executive team, are rooted in the local market. And almost every single one of my executive team members, this is their 911 hospital. So think about that.
Yeah.
You're the mayor of New Lenox. You live in New Lenox.
Yeah.
So the decisions you make are to make New Lenox better.
Absolutely.
Right? Because you want it better for you, your family, your friends, and certainly your constituents.
Right.
We're the same way. Yeah. So when we make decisions based on, do we cut a program at the hospital? Well, if we cut that program, who's going to provide the services to our community? And so you think differently before you cut a service or a program.
Sure. You're vested.
You're vested.
Yeah, 100%.
100%.
And so when you have that local control, you can make other decisions. So you don't just have the hospital. How have you tried to expand and reach out and really provide as much as you can to all the communities around here?
Yeah, great question. And it's something that I think we're continually looking at how do we provide access? How do we provide access to care? Because the last place we want patients to have to go to is the hospital, and especially the emergency department. It's the highest cost of care, and frankly, it is, the craziest place to be if you don't need to be there. So we hope to be able to get to each of the communities in which we serve through having primary care doctors in those markets. So we're in the process right now of rebuilding a location in Lamont that happens to be where I live. But the building that has served Lamont for the last 35 years, 40 years is showing it. And, the building is kind of falling apart around us. So really investing in that community to tell the population and to tell Lamont that Silver Cross is there to serve them long into the future. We built our new location in Orland Park, so stretching our eastern market. That was a huge initiative for us to be able to push to the east further into that Orland Park, Tinley Park market, which directly down I-80 is very easy for A, 911 ambulances to get to us, but B, for our patients to be able to access care then, not only from the hospital if they have to come to Silver Cross, but to be able to utilize our Orland Park campus for their primary care needs, for their imaging and diagnostic needs, for their laboratory services. So looking at, opening urgent care in Crest Hill, I think that's been a little bit over a year now, getting accessed in Crest Hill. We've got urgent care in Mokina that we opened a couple years ago. We have urgent care here on the New Lenox campus. So really trying to provide alternate ways for patients to receive care other than always having to come to the hospital.
Right.
So you hit it dead on by initially asking, what are we doing to try and help communities, and the answer 100% is access to care. We have to provide access to patients so that they don't have to always come to the hospital.
Yeah, you're right. And if those decisions are being made in California or Nevada, that's not happening.
Correct.
They're not expanding
Correct.
like that. So, all right. So at the beginning of the podcast, we talked about how this was going to be a replacement hospital. It is far more than just a replacement hospital. We have Silver Cross Hospital, which is phenomenal, but what you have done is kind of make it a one-stop shop with some of your partners. Who are some of those others that you've partnered with that are right there here in New Lenox?
Yeah, great question. And what I'll say, and again, I'm going to credit my predecessors to really thinking about this, and really from a perspective of how they built Silver Cross is if they couldn't hire and own the business and be the best at that, they were going to partner with somebody in the local market who is the best. So I'll use the University of Chicago from a cancer perspective. So world-renowned cancer program, are obviously rooted in Hyde Park, but partnered with Silver Cross decades ago to provide cancer care at Silver Cross for our community. So we have had a long-standing partnership with UChicago for our cancer care. Shirley Ryan Ability Lab, #1 rehab hospital in the nation for, I want to say 30 plus years. It just came out, and I feel bad I don't remember the exact amount of time, but 30 plus years they've been the #1 rehab hospital. So for us to partner with them and them to be able to provide that level of rehab services right here in our community, whether it be on our inpatient rehab unit in the hospital or running our outpatient clinics, we know we've got the #1 provider of rehab services partnering directly with Silver Cross. You mentioned Silver Oaks. Mm-hmm. We have a partnership with U.S. Health Vest, who run behavioral health hospitals across the nation. Partnered with them to open up Silver Oaks because they are the experts in providing behavioral health care at that acute level. And again, great partnership with them to be able to provide that level of care for our behavioral health patients in the community. Rush University Medical Center, we provide our thoracic care services through them. Dr. Jillian Alex is our cardiothoracic surgeon, or our thoracic surgeon, who is highly skilled and provides services 95% only at Silver Cross. She still goes down to the main hospital and will still provide some level of care down there as a tertiary hospital as well. But just really being thoughtful on the partners that we've chosen to be able to make sure that the care that we're providing right here in New Lenox is that of or equal to or better than the hospitals that are in the city providing the same level of care.
Yeah, right here at home.
Right here at home.
Lurie's too. I mean, you've got
Lurie Children's. That's another huge partnership with us. So Lurie Children's helps us run our 24-bed NICU. So our level 3 NICU, we're the only one in Will County. They provide 24-hour neonatologists that are here to take care of our little preemies. They also provide 24-hour coverage for our pediatric hospitalists. So any pediatric patients that get hospitalized are cared for by our Lurie Children's hospitalists. So it's just incredible.
Yeah, that's amazing. Right, to have that right here, and we're proud to have it here in New Lenox. It's great for New Lenox people, but in reality, it's a regional medical campus for people to get to very quickly and have all that kind of care. That's phenomenal. All right, you have a great reputation, of course. What are the priorities for the hospital? What are your main priorities? Of course, it's, someone might think, oh, that's a simple question, get people healthy and better. But no, it's more than that. So what we're really looking at as far as like quality, patient safety, all of that sort of stuff.
Yeah, well, I would say you just hit it right on the head right there. I think, any of my team, especially the leadership team, would know that if they were asked, what is Michael's number one priority, it's going to be to provide quality and patient safety to every single patient that comes through our door. That has to be our North Star. I believe that, just like every other industry right now, it's tougher and tougher to be able to provide the same level of care that maybe was provided pre-COVID as it is today. But at the end of the day, that has to be our goal, is 100% quality-driven decisions. I think access is another huge priority for us. We have to be able to get patients in, whether it's into the emergency department as quick as possible, whether you find out you have cancer and to get into see the oncologist as quick as possible. Whatever the case is, people don't want to wait for health care. So you get especially if you get a diagnosis, you want quick access to get in. So I think if you were to talk to anybody on my leadership team, they would say our goal is to always provide the best patient quality and provide that with a high level of patient safety, because at the end of the day, that's what healthcare is about.
That's what it's supposed to be about, and that's what you're providing. There's not. So no matter what business you're in, we see it with our police department. I've seen it with teachers. It's harder and harder sometimes to find specialized professional employees, people that want to get into that. It's expensive if you want to get into the healthcare field, to become a nurse, to become a doctor, that sort of thing. How has staffing changed for you? Not that everything revolves around COVID, but I have heard that post-COVID, there were opportunities for, like, nurses, for example, to go work for agencies and kind of be hired, guns for hire, that sort of thing. So tell me how that's kind of changed in your industry.
Yeah, so I would say things have leveled off since COVID. I think during COVID, every hospital across the nation, including Silver Cross, experienced a time where, we had nurses leaving the industry in droves because they're like, okay, I'm out, worldwide pandemic. This is more than I've had to deal with my entire career. So we had a number of, across the nation, a number of nurses that just retired. We, to your point, had a number of nurses who were able to double their salaries to become a traveling nurse and, go into hot zones and or just have the opportunity to travel and make a lot of money, which, I'm a nurse. I don't, and more power to them, right?
Right, sure.
But at the end of the day, here's what I will say. So Silver Cross spent tens of millions of dollars to also make sure that we were staffed as appropriately as we could be, right? And we did that through incentivizing our nurses who are currently working for us, giving them incentive pay to work additional hours. Our nurses in the United States, for the most part, work 12 hours a day, right? Or they work 12-hour shifts, 3 shifts per week. Silver Cross being the same. Right. So we would incentivize nurses to pick up a 4th shift, to be able to help staff, making sure that we were staffing safely and staffing appropriately. So fast forward now, post-pandemic, right? Are there still staffing issues? Yes, there are. There is a shortage of nurses nationwide. There's a shortage of physicians nationwide. I'm going to say radiology falls into that. We have, a difficult time recruiting various different positions within our radiology team, CNAs, certified nursing assistants. For anybody listening out here, if you are interested in getting into healthcare and don't feel like you can spend 2 years becoming a registered nurse, or don't want to get into a BSN program, or to a 4-year degree, go and get your CNA certificate. If you have a passion for caring for people, it's a great way to enter into healthcare, and is a quicker schooling. And I'm going to say there's a huge shortage of people who want to become certified nursing assistants.
Sure.
We love our nursing students who get their CNA certificates as they're going through their program. They will come and support us as student nurses and work as CNAs, but a very difficult position to fill within the hospital. I'm going to say overall, we monitor our staffing through what we call NDNQI, so it's the National Database of Nursing Quality Indicators, and we are typically in the 50 to 60th percentile for staffing, which doesn't maybe sound phenomenal to the layperson, but that is a very aggressive staffing for an acute care hospital. And I think we've been able to maintain and sustain that over the last several years through COVID. And I think our biggest challenge, though, is I'm going to go back to our overflow areas. Yeah. If you've got 20, 30 patients, more than what you have beds for, that's where sometimes we get into the problem where we're begging people to come in and help support those overflow units to be able to take care of those patients that are more patients than what we would have traditional licensed beds for.
All right. So in that vein, though, you talk about how you can, pay a little bit extra to have a nurse pick up an extra shift and something like that, but you're also operating as a business. And so what's happened with the business end of Silver Cross over the last several years?
Yeah, great question. I mean, I'm gonna go back to, again, pre-COVID, and I think many hospitals would support this, that operating margins for hospitals pre-COVID were probably in the 6 to 10% range. I think Silver Cross was blessed to be in that 8 to 10% range pre-COVID. And what I'll say is, coming out of COVID and the cost of inflation that we all are feeling in our own personal lives is no different in the hospital. So everything from the cost of goods that we buy to feed the patients, to the supplies that we have to do surgeries and take care of our patients, to the cost of labor has significantly increased. And so our profit margins of 8 to 10% pre-pandemic are now 1.5 to 2% post-pandemic, right? So it's a very different flavor. And so we really have to be so conscious of every single penny that we spend and really be good stewards of the dollars so that we can continue into the future and not get into a situation where we're looking to close services or, not be able to operate into the future. So we have to look for every opportunity to be able to be cost effective. I'm a big believer that you can't cut your way to profitability.
Sure.
And I'm also a big believer that you, as a healthcare industry, shouldn't go to the first line of defense, which is to cut staff. Right. It is my most expensive line item, right, is our staff.
That's, you talk about quality, that's your staff.
100%. We couldn't do what we do every single day if we didn't have the staff that we have at Silver Cross. And so I, as the president and CEO, will do whatever I can to protect the staffing and the staff at Silver Cross. And so if that means looking, we made a cost-saving decision to change gloves out a year ago, and it saved us $500,000, right? Now I got a few complaints for why are our gloves purple now instead of green.
Right.
Well, because it saved 5 nurses, right?
Right, exactly.
Yeah, so I mean, there's lots of efforts. We're constantly looking at ways in which we can continue to save cost and keep the staffing levels, where they're.
It is a balance, and we see that here at the Village. We are obviously a fast-moving, fast-growing village, and just like you, because I've been at your hospital for many procedures, and your staff, from your volunteers to your nurses to your doctors to the people who are working to clean the rooms, have been phenomenal. I have never come across anybody there that wasn't great. I mean, I love it. Same goes for my staff here, but because we're growing so much, our staff is constantly working very, very hard to try and keep up, but it's that balance. As we grow and we bring in more revenue, then I can hire more staff, but then we're going to continue to grow. So as long as you're going to be working here, or as long as you're going to be working at Silver Cross, you're going to be working hard. And I know you'd love to hire a ton more nurses or pay a lot more or whatever, but it's that fine balance of just trying to stay just a little bit ahead of where you're at.
100%. I think one of the misperceptions that's out there about healthcare is, I'm gonna say the longer we keep a patient, the more money we make, right? And 100% not the truth, right? So we get paid by a diagnostic rug rate, is what it's called, a DRG, diagnostic rug grouper, I think is what DRG stands for. Yeah. But so if you come in for congestive heart failure, we code you as a congestive heart failure patient. And just for simple math, let's say the government says, okay, you should have that patient in and out within 4 days, and here is the amount of payment we will give you for that.
Right.
If that patient is there 10 days or 2 days, we get the same amount of payment.
Okay.
So I'm gonna go on my soapbox a little bit here about Medicaid, right? So obviously, not everybody in the community is blessed with having commercial insurance, right? So we have a portion of the population that is covered through Medicaid. We received our first Medicare increase last year in 18 years. So we were paid the same 18 years ago for services that we were paid up until last year. And so think of all of the inflation and cost of care that has risen 18 years to last year, and yet what we received from the government for Medicaid patients was the same for that entire 18 years.
Wow.
So
no matter the diagnosis. So the diagnosis today and 18 years ago, I mean, that same diagnosis, you were getting the same rate of pay for that 18 years for that particular diagnosis.
Correct.
Even though staffing went up and food went up and electricity
Supplies
went up, everything went up.
Correct.
Wow, that's crazy.
Yeah, and
18 years.
And I have to give a shout out to the IHA, so the Illinois Hospital and Healthcare Association fought really hard, with the government to help educate them on, again, how necessary that was to really fight for that and for the people of our communities.
Well, I'm glad you brought that up, because that is that misconception. Oh, they're just keeping me here because they want more money.
Yeah, not the case.
No, you're losing money.
We're losing money.
The sooner you can get them out of there, first of all, it's better for their own health to get them at home.
100%.
And then the sooner you can put someone else up in that bed.
100%.
And get them home and healthy. That's good. All right. Well, I have been there many times, and I have had great experiences, and you do have a great reputation. There's always going to be things that you need to improve on. There's always going to be people that complain no matter what's going on. It doesn't matter. But and staff that works there, just like staff that works for me, you could see sometimes they're going to be frustrated because they're busting their ass every single day. They're giving 100% over at your hospital, and it can be frustrating. Work is stressful. And when you're in that type of work where people's lives are literally in your hands, that's extra stressful. So you can see why the frustration would mount. But you have nurses and staff that come from other hospitals, I'm sure, that are probably pretty grateful when they get to Silver.
Honestly, Tim, that is one of the great things to be able to hear from a nurse who came from a neighboring hospital. And we have a staffing acuity committee, and formerly as the chief nursing officer, I ran that committee, and it was always interesting, and I always found it a blessing to have people who were both long-term Silver Cross employees as well as newer employees coming in to work at Silver Cross, because I'm going to say 9 out of 10 would say, wow, we wish we'd have found Silver Cross earlier. Yeah. The patient to staff ratios are so much better than what we experienced at other area hospitals, and the ability for me to be able to give amazing levels of care are so much better being in the environment here at Silver Cross. And again, I'd be the first to say, being a nurse myself, I would love to be able to double our staffing or to, do whatever we could. Yeah. But at the end of the day, we're going to end up then not being a community hospital, not being independent, and not being able to provide all the levels of care and service that we have. So we always provide safe staffing and do what we can every single day to make those minor adjustments to make sure that if there is a day or a shift that is a little bit rougher, that we do what we can to be able to tweak that and get support staff in to help as best we can.
So the message to the nurses and to the staff is you realize how hard they're working and how
gosh.
how stressful it can be, and how you'd love to double their pay and double their salaries. But I mean, you've given explanations for what it is.
Yeah, I mean, we couldn't do every single day what we do without the amazing staff that we have at Silver Cross. I mean, staff, volunteers, just like you. I mean, we are so blessed to be in New Lenox and to be in a village that has a mayor who understands about growth and understands how important having healthcare close to home is. So I can turn around and say the same thing back to you, that this has to be a synergistic relationship, because at the end of the day, your team also provides the avenues available for us to be able to build and grow and do all the things that we need to do to be able to support the communities. So without a doubt, I have to give you and your staff 100% kudos on that as well, because you help to make our jobs easier as it relates to making sure that we can provide the service and level of care that we need to have for the communities that we serve.
Well, we appreciate that. It's a critical relationship that we enjoy as well. So you have talked about some of the tough issues, the emergency department, and how that's really a whole hospital issue, staffing levels, which are tough, even pay, that sort of thing, and explain kind of where you're at. Despite those tough issues, though, Silver Cross really has had a ton of success. Why don't you talk a little bit about some of the accolades, because that's not just you and your board, that is your staff. They do need to hear about these things, and I'm sure you tell them all the time, but let the community hear about some of the great accolades that Silver's had. Yeah,
so we just announced a week ago that we are a Center for Medicare and Medicaid Services, so CMS 5-star hospital, so the highest level of award from CMS for hospitals. And what a great honor and great accolade. I'm going to say that is probably the toughest award to win, or the toughest star rating to maintain, because it really looks at quality and patient safety as a whole, and there are hundreds of different initiatives that they look at in order to get that rating. And I will say Silver Cross, over the past 10 years since the star rating happened, we started as a 3-star and have vacillated back and forth between a 4 and 5-star over the past decade. And so the difference between 4 and 5-star is good and great, right? Okay. And I would say even as a 4-star hospital, it's tough to get, because they're looking at mortality and morbidity and readmissions and patient satisfaction and really things that you think are in a hospital's control. But not everything is, right? Everything. So if you think about readmissions, right? We have patients that come back to us because they can't get access to food or healthcare or medicine or whatever the case is. And as hard as you try to help them and wrap your arms around them, they readmit. Right. Well, that's a checkbox against us, right? Sure. So we've worked hard over the past, again, 12 to 24 months, always, but I mean, again, intense focus over the last 12 to 24 months to really look at all measures that are that CMS looks at, but super happy to be able to say that we're back to a 5-star, and we hope to be able to stay there. Health grades, we have been the #1 hospital for surgical services for the last 2 years in a row. Right. And so that means we've outperformed every other hospital in the state of Illinois as it relates to surgical outcomes. And so if you think about that.
Wow, in the entire state.
In the entire state.
#1 last 2 years.
#1 rated by Health Grades for the last 2 years. So again, that is our doctors and nurses and support staff and volunteers. I mean, everybody plays a part in that. But that is a huge accolade for us to get that Health Grades award the last 2 years in a row.
I helped out because I had probably like 4 procedures there. I mean,
thank you for that.
You're welcome.
And thank you for healing.
Good. They all worked out well. Yeah, exactly. What else have you got?
Yeah, again, Leapfrog has been a third-party organization that looks at the safety of hospitals and it's probably been, I don't even know, maybe 15 years that Leapfrog has delved into rating hospitals. We had been a 22 consecutive A-rated organization. I'm going to say we just by 0.07 missed our A this past time. So we moved from an A to a B. But we kind of knew it was coming. We had a couple situations that happened in the hospital from a perspective of clinical outcomes that we knew were going to come back to, potentially haunt us a little bit in our leapfrog A rating. We knew very quickly how to solve for that, and put a lot of countermeasures in place to make sure that that we will be back to an A again for the next rating period. So, and here's what I will say: I think it's very humbling for us. It's very humbling for me as the leader to not be an A, right? To not be a star performer. But at the end of the day, it is again something that I think that you have to learn from, right? So we had a lot of intense focus on it, and we've got amazing doctors and nurses that know that quality is our North Star, and so we will be an A again.
Yeah, and even across country, U.S. News and World Report, right? One of the best hospitals.
Yeah, best regional hospital with U.S. News and World Report. It's funny because I've had some people ask me, well, how can you be a 5-star hospital and a B, or how can you be a U.S. News and World Report? And really each rating agency looks at so many different angles of how the hospital performs, and looks at different lengths of time, looks at different rating periods, looks at different measures. And so it's almost mind-boggling. We have a chart that kind of looks at all of the different configurations of how we get rated and try to match them up between all the different rating agencies. And I mean, it's a chess game far above my ability to be able to comprehend at some point. But again, we know what we have to focus on, and are very, very excited about the accolades that we get. For me, it's not necessarily about the accolades. It's about the care that we give that gets us the accolades. It's just nice to be able to have the community understand that we are a very quality-driven and patient safety-focused hospital.
Well, and it's one more way to say thank you to the staff. The staff and the volunteers to do all of that. Those accolades belong to everybody. Of course, the leadership, the board, but all the way down to every single staff member there. If they weren't doing those jobs, you wouldn't have these accolades. And the reality is 95% of the hospitals in the country would kill for these accolades. So,
yes, they would.
So you're in great shape. So, well, that's wonderful. So any last thoughts where we headed from here? Anything else you want to add?
Yeah, no, I mean, I think we're excited to go into the future and to continue to provide, quality healthcare to all of the markets in which we serve, and look forward to continuing to grow and expand into other communities. I think there's lots of additional places that we'd love to have a Silver Cross building in the works. So we're continually looking at where does it make sense for us to have additional access points, and look forward to continuing to serve the public and be a high quality patient safety driven hospital and healthcare organization.
Well, I can tell you on behalf of the 30,000 people that live here, we're grateful to have you. We appreciate you acknowledging the things that you have to work on. I mean, because there isn't an organization in any line of work that doesn't have to continually be working on something. But owning it and trying to improve and do better, that's all we can ask for. But you're starting from a pretty high level already. You guys do amazing work there, and we're really, really grateful for what you do for our community and for the region. So thank you for being here.
Thank you.
And please, again, pass it along to all your staff.
We just did.
The best. Yes, we did. So make sure you put it in the company newsletter so they're listening, because we're very grateful for all the hard work that they do. They're amazing people. Amazing people.
Thank you. Likewise.
All right. And Don, thank you as always for everything that you do. And for everyone out there, I want to thank you for listening to this edition of Too Honest for Social Media.